Pfizer COVID vaccine tested on stopping the transmission of the virus before it entered the market? If not, please say it clearly. If yes, are you willing to share the data with this committee? And I really want a straight answer, yes or no, and I'm looking forward to it. Thank you very much.
Dank u wel, meneer Roos. Monsieur Botteng.
Merci Madame la Présidente et merci aux représentants de Pfizer et de CureVac d'être avec nous. Oui, effectivement, je ne sais pas si vous avez été justement informé, mais l'objectif est effectivement que vous répondiez aux questions. Ça fait 1 heure qu'on est là, on a déjà répété quelques questions et vous n'avez toujours pas répondu. Donc je vais essayer de faciliter la tâche en faisant des questions oui, non où il faut juste un chiffre. Alors, d'abord sur les négociations, depuis 2022, et ça s'adresse à Pfizer et à CureVac, combien de messages électroniques votre PDG a-t-il échangé avec la présidente de la Commission européenne? Avouez-vous, oui ou non, des négociations parallèles en dehors du processus normal, oui ou non? Est-ce que votre PDG envoie encore aujourd'hui des messages électroniques à Madame van der Leyen? Est-ce qu'il y a d'autres dirigeants européens ou du monde auxquels votre PDG envoie des messages électroniques? Combien de rencontres a eu votre entreprise directement ou indirectement avec des fonctionnaires de la Commission européenne? Avec quels députés européens avez-vous eu des échanges, des rencontres? Et est-ce que vous considérez que vos intérêts sont bien défendus ici par des lobbies comme FPA et Vaccine Alliance? Voilà, ça fait sur les négociations au moins quelques questions claires. Sur les prix aussi, on va y revenir parce que vous esquivez systématiquement la question du prix. Pourquoi est-ce que le prix du vaccin, et ça c'est pour Pfizer, a augmenté de 20%? Pourquoi? En 2021, votre directeur financier Frank D'Amelio a dit que pour lui, un prix normal pour le vaccin Covid pourrait être jusqu'à 150 €. Est-ce que vous confirmez, vous êtes d'accord? Combien devrait être le prix de ce vaccin pour vous? Est-ce que vous faites toujours, comme le disait la People's Vaccine Alliance il y a 1 an, 1 000 $ de profit par seconde grâce à ce vaccin? Sinon, combien par seconde, par jour, par semaine? Et finalement, grâce à ce vaccin, combien d'argent en dividendes est-ce que vous avez pu verser extra ou en bonus vis-à-vis de votre management? Et juste une dernière question. L'apport public dans le développement de ce vaccin a été fondamental, que ce soit la recherche de base, que ce soit le soutien public que votre partenaire BioNTech a reçu. Pourquoi alors devriez-vous être les seuls propriétaires de ce vaccin? Je vous remercie.
Mr. Sinchits.
Thank you very much, Ms. President. I must say that it is really a disgrace that Ms. Borla is not with us today, and even greater disgrace that he doesn't have any real intention of showing up. I must say that we in Croatia know very well how Pfizer works. Pfizer was penalized in 2012 in Croatia for bribing Croatian doctors responsible for registration of medicines, and also doctors in Bioethics Commission who were evaluating clinical trials. And in the end, Pfizer had to pay $60 million. Back a few years back, you were also fined, I believe, in the United States for $2.3 billion for false advertising. And it's a long list, but I won't spend my time on that. I'll go straight to my question. My office received an assessment from independent researchers from Canada, 500 of them, Canadian doctors, scientists, and healthcare practitioners, independent. And it is an assessment regarding original trial report from December 31st, 2020. I suppose it's your clinical trial published in New England Journal of Medicine. So in this assessment, they went through your data and they claim that you failed to test your product in a correct way, that you had inadequate control groups, that you had wrong clinical endpoints, that it was not tested for spread reduction, that you skipped animal testing, failure to report serious adverse events, that the trials were unblinded, and the list goes on and on and on and on. So there are a lot of problems with your trials, they claim. So my question is, were these original trials, according to which the vaccines, your products, were approved, for example, in the European Union, were these trials verified by somebody independent, somebody who is not from Pfizer? Yes or no? Thank you.
Thank you very much. Mr. Small, can I also ask you to go into all of these questions? Even if you don't have the answer, just say you don't have the answer, because otherwise there is on the SMS or WhatsApp, I don't even know what it is. It's important that you give an answer, but also on the rise of the price, it is important that you give an answer. We had an inquiry of the ombudsman, woman, on the SMS. We had the ECA report, so it's quite important for this committee that Pfizer can give straight answers to that. Please.
Yeah, no problem. Obviously, if I can be given a little bit of extra time then as well.
I'll give you 2 minutes extra.
If that's possible, that would be very helpful. Thank you very much indeed. So let's start with the SMS. Texas in that respect, and so and again, I do apologise that Dr. Bula is not here, and hopefully, as I said, from my experience, that I'm able to provide as many answers as possible. Now, regarding the SMS texts, and I know this is very specific, but I think everybody understands that during a pandemic, we were all working at home, and as a result of that, I am sure Dr. Bula provided his mobile phone contacts to be able to speak to many leaders around the world, including myself. I was able to do that, and I'm sure you did similar situations as well. Regarding your specific question as to whether a contract negotiation such as this contract, which you referred to, 1.8 billion doses, was negotiated through an SMS, I can categorically tell you that would not be the case. I know that because, as I mentioned earlier on, I actually was involved in all the negotiation discussions from the very start, from the beginning in 2020. As mentioned, there are very clear procedures and approaches at Pfizer, as well as at institutions, governments and organisations. It requires a huge team on both sides to be able to negotiate the complex aspects of what is contained in a contract. It is not possible, I can assure you, to conduct these things over an SMS text. The number of SMS texts, honestly, and be quite genuine here, I have no idea how many. So you wanted a special number. I cannot, sorry, give you that number. I couldn't even tell you how many I had myself in terms of world leaders, because we're not counting that particular type of statistic. But from the point of view of actually understanding the way that a contract is negotiated, it takes many days, many hours, many weeks in order to be able to go through the very complex aspect of what a contract contains. Regardless of, in addition to obviously the legal aspects of it, there are delivery schedules, there are supply approaches, that's gone down into weeks in terms of detail and information in there. And so therefore, from a Pfizer perspective, the contract followed the appropriate conversations and discussions in a way that a contract takes place. Also, in addition to that, it was awarded through a successful tender process, and also all member states via the steering board had all were able to agree to all of the details that contained within that contract. So I hope I've been as clear as possible around the SMS texts and the potential parallel conversations that would not be able to take place to conduct a contract as complex as these contracts are regarding our vaccine and also in terms of our oral treatment. Regarding the question around did we know about stopping immunisation before it's entered the market? No. We had to really move at the speed of science to really understand what is taking place in the market. And from that point of view, we had to do everything at risk. I think our Dr. Bula, even though he's not here, would turn around and say to you himself, if not us, then who? Dr. Bula actually felt the importance of what was going on in the world. And therefore, as a result of that, we actually spent $2 billion at risk of self-funded money from Pfizer to be able to manufacture, first of all, research, develop and manufacture at risk, to be able to make sure that we were in a position to be able to help with the pandemic. And I think that's why I feel very good when a recent paper from the Imperial College stated that in the first year of the rollout of vaccines, we saved 4 million people. So from that point of view, I feel that actually we were there when the world needed us to be able to make sure that we were able to help people around the world with vaccination as well as now oral treatment. I would hate to imagine what situation we would be in the world right now if companies like us did not take those risks, did not do clinical research and developments at scale in order to make sure that we could have a vaccine that we could roll out to the world. So I understand your frustrations, I really do. But I also hope at some point, somewhere, you also do appreciate what pharmaceutical companies have done in order to be able to roll out and deliver vaccines at such speed and scale. Regarding, sorry.
Price.
Oh, price. Okay. Right. Sorry. Honestly, it's on my notes. I just haven't got to it constantly. It is there, isn't it? Pricing. So, look, I understand you've talked a lot of pricing and thrown out a lot of prices. But from our point of view, we cannot discuss pricing. Pricing is confidential. And from that point of view, I know, again, you're going to be very frustrated. I can see it in your faces. You're going to be very frustrated with my answer. But pricing is confidential. And from that point of view, I am not able to have a conversation with you other than to repeat what has always been out there, in that we have taken a tiered pricing approach to pricing to make sure that it is affordable for the governments to be able to ensure that citizens can have it without out-of-pocket funding. And in addition to that, we've made sure that low and middle-income countries are having it at not-for-profit. I understand your frustration, but we cannot discuss pricing. It is confidential.
I think at a certain moment of time, we will need to take some legislative action with regard to that, but that's open for discussion. Mr. De Haas, Dr. De Haas, please.
Yeah,